So in this patient example, I'm going to show you someone who had, in January, a extended subsmass facelift or a deep plane facelift. And you can see in the picture the jawline. I think focus on the jawline. That's the main area of improvement that we're trying to accomplish. And also what we call the malar, the submalar tissues that can become ptotic or sag as well. When we released the ligaments that we did on her, the zygomatic cutaneous, the anterior masseteric, and the mandibular ligaments, we're allowing the mobile tissue to be lifted up. And that's why we can create the improvement to the jawline. Now, the jawline cannot be made perfect. So your expectations in terms of, yes, you lift up the tissue and you're like, yeah, I want it to look like this. That's really impossible with a facelift because we're moving the muscle, advancing it upward and outward. That allows the muscle layer to sit in a more elevated position. But also remember there are, which I didn't go into, there are 5 different layers of the tissue on top of the bone. There's your skin, there's your fatty layer, which we call the subcutaneous layer. There's the SMAS layer, which is that fibromuscular layer that we're moving. Below that, there are the facial nerves. Below that, the facial nerves and your salivary glands and deeper fat structures. And then the 5th one is just really the covering of the bone. So all of those different layers as you age begin to slide away from each other. So when we lift the SMAS layer, the deep layer, the epidermis, the surface of the skin, and the fat also are mobile and become more mobile as you age. So when you lift everything back, it looks great. And then 3 to 6 months later, there's a loss of edema, there's building of collagen. And so those layers can slide from the muscular layer that we lifted. So again, in her, she can't be made perfect. She still has a little bit of jowling. She has some lines in the face, and we use fat grafting as a way to help those lines. So again, as swelling goes away 3 to 6 months later, I think at 6 months, you still have about 20% swelling in the face. And like when you do rhinoplasty, the tip of the nose is still swollen at 1 year after surgery, but it's not noticeable, but it's still there. So in this patient, what I want you to see the jawline, the smile fold, the marionette lines here, and just the improvement of the neck. Again, the neck we can make as clean as your own anatomy will allow us, because we all have different anatomy, where your windpipe is positioned, where your floor of the mouth and how tight all those muscle layers that help in chewing and swallowing are aligned, where your fat is positioned, and what the strength and the nature of the platysmal muscles, because you have 2 muscles on the side, the platysmal muscles, and in only 20% of patients are they connected in the midline here in the submental space. So depending on your genetics and how you age, the thickness of your tissues, and where you are in the aging process, we can improve you a significant amount. What I usually tell my patients is how much improvement that I can give them is usually 70 to 90 to 95% of where they start from. But that matters a lot depending on your aging, where that aging process you are. So if you're 40 and you have a procedure like this, you can get a better result than when you're 50. If you're 50, you can get a better result than you're 60. So you can look refreshed, and that's the goal. That's the important goal, is looking refreshed, cleaner, like you lost weight. Those are all important aspects.